Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a video about how to support kidney health and function. One of my favorite patients posted this video, or posted this question rather, on one of my videos, and very happy to answer that question. It's a great question, and yeah, happy to answer the questions of patients of the clinic. Absolutely. And just before I get into this, I have been posting some videos on YouTube, and just in case you're watching this on YouTube, just FYI, I don't get any sponsorship funds at all or no paid advertising funds through YouTube. So I noticed just looking at some of my videos recently, and I saw that there were these advertisements like, oh my goodness, YouTube did not ask my permission, and according to their fine print, they don't have to ask. But just FYI, I don't endorse one way or the other any videos that might have been on this video, or might have been played before this video if you're accessing this through YouTube, just FYI. So they're just doing that of their own volition, and I guess they get to do that because they're YouTube and they can do whatever they want. So getting back to the topic at hand, when it comes to kidney health and function, and bearing in mind that nothing that I'm about to say should be construed as medical advice, please talk to your personal health provider before making any decisions about your health. But just for informational purposes, when it comes to kidney health and function, the main things to focus on are making sure that the kidney cells have adequate anti-inflammatory and antioxidant support. And that's largely because the kidneys, they have to deal with a lot of toxic stuff. They're flushing out toxins, they're flushing out metabolic waste products, and that's not very easy on their little cellular bodies. And so making sure that there's adequate anti-inflammatory and antioxidant support is really important. Now, it's also important, and those of you who listen to my videos would have heard me say this a million times, but mitochondrial support is really, really important. And at the end of the day, why is it that anti-inflammatories and antioxidants are important for kidney cells? Well, if there is too much inflammation, that's not good for the mitochondria. If there are inadequate levels of antioxidants, that's going to cause lipid peroxidation. That's going to compromise mitochondrial health and function. It's going to compromise other parts of the cellular function too, but the mitochondria are just so very important. So at the end of the day, there's not really there's nothing really that magical or unique about supporting the kidneys, but sometimes they do need extra antioxidants or extra anti-inflammatory support over and above what other tissues might need. So I've worked with quite a few patients over the years with chronic kidney disease. It's not a specialty area of mine, but just over the years, having seen thousands and thousands of patients, I've had a number of patients with chronic kidney disease. And what I have found is that the therapies that have been the most effective at helping to stabilize their kidney function numbers, or quite frankly, I've had a number of patients where their kidney function markers start to improve, go in the right direction. Some of the tools that have been the most helpful have been appropriate dosages, and oftentimes fairly robust dosages of R plus alpha lipoic acid. Curcumin can be helpful. Glutathione can be very helpful. Sometimes milk thistle can be helpful. Resveratrol can be helpful. Quercetin can be helpful. So I don't recommend all of those things for all of the patients that I'm working with who are dealing with kidney issues, or where I want to really help protect or try to enhance their kidney function. But those are some of the tools that I might draw from. And granted, in some cases where patient their kidney function, like their EGFR levels down at like 15 or something like that, it's like in those cases we might add all of those things into the mix at appropriate dosages to try to protect their kidneys as much as possible, because at that point there's not a whole ton of kidney function left. So I hope that answers your question, patient of mine. If you have any further questions about this, or if anybody else has any questions about this, or really any other topic, please feel free to post it in the comment section below, and I'll do my best to answer it as soon as I can.